Today we're going to be doing one of my favorite exercises. We're going to be doing squats. And squats are perhaps the most functional exercise there is out there. If you can squat well, you can do a lot of things throughout the day well. And you might be thinking, Dave, you know, not today, not with my knees, not with my hips. But I'm going to challenge you on that because squatting is part of almost every or many activities that we do throughout the day. If you got up out of a chair today, if you got up off the toilet today, if you got out of a car today, you did some form of squat some way or another. And if you are better at doing that squat, you're going to feel more comfortable, you're going to feel more powerful, and you're going to have an easier time getting through your day. So to be able to practice just some of the techniques and understand some of the principles can really alleviate a lot of pain. It can actually demystify the movement and maybe take down some of the fear, and maybe you might even start to enjoy them. Maybe, we'll see. All you're going to need for this is a chair or a countertop for balance and an open mind and a willing heart. I'm Dr. Dave, physical therapist. This is Arthritis Help. Let's get started. Okay, so we're going to be standing right in front of something that you're going to use for balance, not to put your weight on, but just for fingertip balance in case you start to sway a little bit. And we're going to break down squatting into the three major elements: the descent, the transition, and then the ascent. And we're also going to talk about common pitfalls and problems that people develop with all these that sometimes contribute to the pain and difficulty. So first thing is going to be your start position. So you're going to start facing your countertop or back of a chair, and your hips are going to be, or your feet rather, are going to be about hip width apart or shoulder width apart. You don't want to be narrow, and you don't want to be so wide that you're beyond the shoulders, so about shoulder width apart. And we'll start facing the chair. And first, we're just going to get a sense of the balance. We're going to get a sense of how we line up over our feet. And I want you to feel that you're able to use the back half of your feet from the kind of middle of the arch back to the heels as your platform, as your foundation that you stand from. Some people have a tendency to kind of push and lean into the balls of their feet. That's okay. I just want you to see if you can find the heels without falling backwards, without lifting the toes or tipping up. Can you just balance yourself over those heels? Good. Now from this position, what we're going to do is we're going to keep the body up nice and long, but we're going to bend at the waist and throw your bottom back just like that. A little hinge, a little forward bend, and then come right back up. And I want to make sure that when you're doing that, you're not slumping, right? We're not rounding the back. We're keeping the back pretty straight, and then we're just throwing the bottom back. And I want you to feel that when you do that, the weight shifts back toward the heels kind of naturally. You're aligning your body back towards the heels. And then you come up, and you want to see if you can kind of almost stay aligned over those heels. When the hips and butt come back, the head comes forward as a counterbalance. So the weight that's going backwards is countered by the head coming forward. If you don't have the head come forward and you just bring the butt back, you're going to wind up falling back. So if you feel as though you're losing your balance backwards, make sure that you're allowing yourself to bow as you hinge so that you can stay balanced over the heels and that you're balanced from front to back and up and down. Very good. That's the first part of the squat. I want you to see, just as a contrast, and what people often do is instead of bending at the hips, they just bend from the knees. And I want you to see what that feels like. And when you bend from the knees just like that, you're going to feel that the weight shifts forward into the balls of the feet, almost takes the weight off of the heels, and it puts a lot of stress in the front of the knees. This may be a painful or uncomfortable position for some of you, so I recommend you not to do that. So we're going to avoid that as we're going down. And throughout the squat, we're going to be kind of monitoring that knee position, seeing if we're falling forward or if we're drawing backward. Okay, so that's the first part, is that we bend from the hips and not the knees. So we're going to do that hinge from the hips just to wherever you're comfortable. And now this is where the knees come into play. Now we have to bend the knees to lower down. So we're going to bend the knees to lower down. But as you do, we don't want to allow those knees to come forward. So you're going to be constantly pulling your knees backward and just driving your bottom backward as you lower down. And your head is going to be forward and hands can be rested on your support. And then just come up any old way you want. We'll work on the up at the end. You can come up any old way you want. I just want to work on the down. Okay? We're going to move backward from the hips. Feel the weight on your heels. And then you're going to bend the knees, but not in a way that comes forward into the toes, not into here, but in a way that draws you backwards so the butt goes back and the head comes forward. If you feel that you're falling backwards, you're a little bit too upright, you need to bring your head down so that way it'll counterbalance your backside. And then again, come up any old way you want, don't worry about it. Something you have to watch out for, people with knee pain very often don't like to bend their knees. They're reluctant to, and I understand why. So what they wind up doing is they'll bring the hips back, they'll bend the knees a little bit, and then they'll just drop the head and chest down and think that they're doing a squat, but really they're just bringing their head low and there's no bend at the knees. So you want to make sure that you're not just dipping the head down, but after you do your hinge, that you're actually bending the knees to lower yourself down, but at the same time the butt is coming backwards and the knees are coming backwards and the head is coming forward, and you have that balance. And come up any old way you want. Remember, work within your ability level, okay? Don't put yourself into pain. Experiment. If something hurts, try it a different way, but don't constantly work into pain thinking that you're making yourself better. Rule number one, you know rule number one, always be kind to yourself, okay? So work within your body, experiment to find more comfortable and efficient ways of moving, and don't work into pain thinking that you're making something better. So we're gonna try that again. Hips back, bending the knees down a little bit, and the head dips down a little bit. And if you can only go a little bit into the squat, that's it, that's all you go, that's perfect, right? We're just gonna work within whatever your ability is. Let's just do a few of those. Come down. And you might feel from here that if the knees start to go forward, if you let those knees bend forward, again, you might feel that stress and pain, that old familiar pain that you used to feel. And then we're going to come up. Okay, so that is the descent. Okay, now we're going to work on the transition, how we transition from the descent to the ascent. It's a little bit tricky, so try to follow. When we're coming down into that hinge, and we lower and we're keeping the butt backwards, we want to make sure that we're maintaining a neutral spine. Some people, if they arch their back very easily, will get into this kind of tail out, chest out position, and that will make it very difficult to use the right muscles on the ascent. So what you want to make sure is that you have a little bit of a curl as you come into that bottom of the squat position, and that curl should drive weight down again into your heels. And then again, come up any way you want to. We're not going to work on fixing the ascent yet. Try that again. You will take this little bow, right? You're going to bend the knees to descend, and then you're going to give a little teeny tiny tail tuck, a little curl that's going to drive weight down into the heels. When you do that curl, you should feel the muscles in your thighs and maybe even your butt really start to sing. They really start to activate and work. And that curl turns the muscles on. It transitions the strain from the joints into the muscles, and that's what we want. We want those muscles working full and taking the pressure off of the joints. So we're going to do that same thing again. Take the bow, bend, and sit back, and as we get to the bottom, little tail tuck, just a little bit. We don't want to over tuck, so we're kind of rounded through there, right? We don't want to go too far in the opposite direction, just enough so you can feel these muscles start to sing and you can feel the weight driving right down in through those heels. Good. Come up. Whew. Take a minute, take a rest as needed, work at your pace, don't work at my pace, work within yourself, pause the video, come back to it, whatever you need to do. Okay, now we're going to talk about rising up and how we come up. And this is really important for getting out of a chair or getting upstairs. And so we're going to do everything that we did on the way down. We're going to take the bow. We're going to drive the hips back. We're going to bend the knees. We're going to make sure that the shins are staying pretty close to perpendicular, not tipping forward, but straight up and down. We're going to find that little curl. And as we do, we're going to drive the weight down through the heels. We're going to push through the heels by pulling the knees backwards in space a little bit and continuing to tuck the tail a little bit until we drive all the way up into this finished position. And a good squat, the knees come back at the same time as the hips come forward, okay? And so you should finish in that nice up and down position. Let's come back down into the squat, and we'll think about that little curl to drive the heels down. We're going to continue to drive down through the heels by pulling the knees backwards, almost pushing down into these perpendicular shins to come up and pulling those knees back. So we finish, and we finish in this maybe a little bit sunken chest, all right, into this position. Now I'm going to show you a pitfall. I'm going to show you things that people often do that put more strain in their back and in their knees. They come down, and when they come up, they try to get up from their chest, right? They want to be finished so early that what happens is they come up and the knees start to go forward and the chest comes up, and then they kind of finish through here. I'm exaggerating that, but that's a very common way to finish. So I'm going to show you that one more time. Instead of tucking the tail and pulling the knees back, they arch the back, lift the chest, and come up. And sometimes people never even fully straighten their knees. They always have this little bit of bend, so there's always this pressure that puts a lot of strain through the knees. So you want to avoid that. The way you avoid that is you come down, little tail tuck, drive the heels down into the floor, pull those knees back, and finish up tall. Another thing that people do, which is not as bad, but it's not perfect, is that they come down and sometimes they push the knees straight and then they bring the torso up, right? And that's a way to take a little bit of weight off the legs, but it doesn't give you that strength. It doesn't give you that drive. So you don't want to be doing like 1, 2. You want everything to finish at the same time, nice and upright. All right? So now we're going to put it all together, okay? All the pieces as we go. We're going to start, feel the weight over the heels, feel that we're in a nice hip width position. You can have fingertips just resting, not leaning, but just resting on a support in front of you. First move is to take a little bit of a bow, butt goes backwards, chest goes forwards. All right, and then we're going to bend the knees to lower the bottom down, but not let those knees transition over the toes. The butt keeps on going back, the head keeps going forward, and we lower down to wherever you feel comfortable. Whatever works for you is perfect. From there, we're going to do the transition, which is that little tiny tail tuck to feel these muscles start to activate and drive the weight down into the heels. We're going to push down through those heels by pulling the knees backwards in space. So important, the knees backwards in space. That's probably the #1 most important thing to save the knees as you come up. Now, I'm going to show you one little trick, one little tool to help keep you honest as you're going through here. So what you're going to do is you can take I'm going to use a cane, but you can take a broomstick or anything kind of long and strong, and you can just kind of put it along your back, from the back of your head to your tail, just like that. So you can kind of get a sense of where your spine is in space, right? Just like this. So if you really bow your back out, you'll feel the cane kind of do this. And if you, maybe this way is easier to see. And if you really arch your back, there's going to be this big gap in the middle. So you just want to stand and see. If you can't get your head all the way back to the cane, that's okay. It can be off. If you can get your head there, that's fine. And you're going to see that as you come down, we need to take that hinge. We're going to bend the knees and lower down. And then we're not going to arch, and we're not going to round. We're just staying neutral. And then we're going to push through those heels to come up. So this little cane or broomstick or an umbrella is just a little trick to help you figure out where your spine is in space. So there's one less thing to think about. But real important to pull those knees backwards and keep those shins pretty up and down and not leaning forward. Okay, this takes a little bit of practice, and I would encourage you, if it's painful at all, just make it smaller. There's always something that you can do. Just make it smaller, go within whatever your body gives you. But once you get better at the coordination and understanding how to use your body to create downward force to drive the body upward, and using these big muscles and getting them strong and doing their work, so many things become easier. Getting out of a chair becomes easier. Going up and down stairs becomes easier. Getting off the toilet becomes easier. Things become more comfortable. Inflammation goes down. Happiness goes up. So only positive benefits from that. And that's it. That's the squat. I just want to thank you all very much for joining me today. And I want you to thank yourself for taking the time to do the work that's going to get you to where you want to be. Not everybody does that, but you did today. So congratulations to you. That is something that you should really be proud of. I'm going to be back with you next week with a whole new video teaching you how to move differently so you can feel better. Take care, everyone.